Well, it's finally a day a lot of parents have been waiting for. Kids between 5 and 11 years old can now get a Pfizer COVID vaccine. The FDA, CDC, and the Western States Group have all signed off on it. And yes, they all reviewed the safety data in Pfizer's trial for kids, which, by the way, did not find a single severe reaction related to the vaccine. However, one child in the trial did swallow a penny, so that was recorded as a severe adverse event for transparency's sake. Ashley Korslien joins us now. You had a chance to talk to the Surgeon General today. Kind of cool. He has a couple of kids. What's he say about this? Yeah, so Dr. Vivek Murthy has 2 children, ages 3 and 5. So the 5-year-old now eligible with that 5 to 11-year-old age group that's next up for the shot. You know, he said just like a lot of parents, he's got questions about safety and does it work? And those were his 2 big things. Is it safe for my kid? Is it going to be effective? He says, yes, it is safe. He totally trusts the science and the research that went into this vaccine. Now, as for whether it's going to work for this age group, he says, yes, 90% is what the trials showed us. It's 90% effective, the vaccine is, at preventing symptomatic infection in these kids. He also wants to point out there's lots of misinformation out there, and his plea is to really urge parents to go to trusted sources, your pediatrician, the health department, your doctor, and ask them for their opinion. Yeah, you don't necessarily have to trust us, although of course you should. What about kids under the age of 5? Will there be a shot for them? So I did ask Dr. Murthy about that, and he says it's going to be a little while, so parents need to sit tight. He is anticipating that it won't be available for kids under 5 until at least the start of the new year. So I did press him on that a little bit to get his opinion, and here's what he had to say about it.
They fully understand how important it is to get a vaccine to protect our children. Getting vaccines in general to the population on COVID is their top priority. But they don't want to cut any corners in doing so. They want to follow the same rigorous standards they've always had because they want parents to know that they can be confident in the recommendations that they're making because nothing's more important ultimately than the health and the safety of our children. Well, that is interesting. Also, you asked him about his stance on the vaccine mandate for students. Interested to hear what he had to say about that. Yeah, I was very curious because, as we know, there are school districts around the country either that have imposed this or certain states are imposing this or looking at a vaccine mandate for students. Right. And when I asked Dr. Murthy about this, he didn't really answer it. He sort of punted that question, saying he defers to local and state officials to make those decisions. So really a non-answer on that. I couldn't get him to commit, but his point was, look, parents are going to have questions. People need to give parents grace, and they should have questions. They should be asking a lot and digging in for the data and wanting to know. He says, at the end of the day, we all care about the safety of our kids, and that's what it comes down to. Yep, and if getting them vaccinated makes them safe, makes it a pretty simple answer. Personal decision there, but yeah, for sure. Thank you very much, Ashley. Yeah.